Greetings, WellBeings. I'm Dr. Sherazad, a board-certified internal medicine doctor with over 10 years of experience in a hospital setting. The Pitt episode 11 did something that I did not expect. They walked straight into the most politically charged, clinical, terrifying, morally complicated shift I've ever seen this show depict. Let's get into it.
I got a hot and unresponsive child. I need a room, Dana.
Trauma 2. Has Micah been sick with a fever?
No, he was fine all day. I found him in the car.
Oh my gosh, the mom is drenched.
Airway is patent with low tidal volume. Let's set up for intubation.
That means he's like breathing, but shallow and slow.
22 in 10 seconds. That's 132.
Call respiratory.
You said you just found him in the car?
I was working in the garden while he rode his trike in the driveway. 1 minute he was there, and then he wasn't. I couldn't wake him up.
How long was he in there?
Maybe 15 minutes or...
She said she was when the temperature is this high, the muscles can lose their strength. So we're going to help him breathe with a tube.
So basically, this is a pediatric heat stroke. It's one of the most fastest moving emergency cases ever seen because the temp is at 105. Normal body temp is around 98.6 Fahrenheit, and heat stroke is over 104 degrees Fahrenheit. I actually dealt with this in someone that I know, young, college, healthy kid, was like super overheating because they were in the sun all day and probably partying with the frat boys and dealt with a heat stroke. Brain damage can happen at 105 degrees or more. And what Dr. Al-Hashimi just shared is that the muscles become flaccid. And one of the biggest muscles that helps us breathe is called our diaphragm. The diaphragm is a not flat, but like dome-shaped muscle that separates the thorax cavity from the abdomen cavity.
That's 105.5.
That is very high. The tip to walk away from is never leave a kid alone in a hot car. People don't really take classes on how to be a parent. They just get to be a parent naturally and biologically. I really think parents should take lessons and get a license to learn how to parent because so many people don't know what they don't know. And honestly, people could learn a lot more by conscious parenting classes. One of my favorite teachers, Dr. Shafali, teaches psychology and she teaches conscious parenting classes online and all over her social media. She is an incredible advocate for conscious parenting because so many times we just don't know what we don't know and it's no one's fault. But I really do think we should all learn more about how to be safe with our children.
Shit is nasty and can lead to skin necrosis.
I've never understood drug addiction.
Well, you need to try. A little empathy goes a long way in this job.
Yeah, seriously.
Healers, not judges.
That is a sentence that we should tattoo on every medical healthcare worker's brains, including mine. We're healers, not judges. It just comes across so naturally, like humankind is made that way because like what they just summed up is the entire philosophy of street medicine in one sentence. He's like never understood drug addiction and he was also like super wildly rude to the man with obesity.
I am empathetic. I don't understand how an intelligent person allows themselves.
Can make mistakes, heal themselves, take away the pain, hide from the abuse.
I think that empathy has a long way to go with like understanding. And because healthcare workers may or may not have been exposed to like mental health in their family or drug addiction or whatever, they have a tendency to come across as judges instead of healing for the patient.
How's it going, Kiki? So what's happening with you?
My leg's getting stinky again.
Yeah.
I like how they're out in the street like doing medicine like that. That's kind of crazy.
Okay, let's take a look.
Is that an injection site?
No. No, xylazine wounds can show up anywhere.
Xylazine is a sedative that was originally designed for animals, so specifically horse and cattle. It's not used for human approval or use, but it's been showing up mixed with fentanyl, and it creates these horrific skin wounds, like rotting skin flesh, and that's what's the distinguishing feature of xylazine.
You still using Trank?
Sometimes.
You know, it's nasty stuff.
I'm trying to quit. I go to meetings sometimes.
Meetings are good.
Woo!
And not using's even better.
I'm staying quiet because I'm letting the show take it, but like honestly, he's stunned. I'm stunned too. Like that skin wound is nasty. So like, of course you're going to be like, why do that to yourself? Why? It's a brain problem. It's a neurological psychiatric disorder that you cannot judge. You just have to treat. As much as you want to do something for a patient for themselves, like quit, you can't. Just like when the alcoholic guy was struggling and he wanted Robbie to just put him out on the street so that he could drink more whiskey or whatever. Robbie was like, I don't have to give you the tool to get you out there to do that thing. Like, I can still treat you. Like, I don't have to give you the thing that's going to hurt yourself. I can keep advocating for you. And remember when he died, we learned that the reason why he was drinking was just super depressed. He had been through so much trauma and pain.
My plan is clean with saline, antibiotics.
Meta honey to break down the eschar. And then?
Wounds either need to be like surgically.
Zero form and an ABD pad and acrylic wrap.
Yeah, that's...
Wounds either need to be surgically debrided or medically treated for pain.
I don't think I can do that.
We'll give you all the supplies. You can do it yourself. You won't even have to come back here.
So wound care is a whole subspecialty of medicine, and a lot of general surgeons do wound care, but wound care is fascinating because there's very specific treatments and protocols to follow for wound care. And like as an internal medicine doctor, I commonly have to write prescription orders for home health companies that provide skilled nursing, like RNs or LVNs, to follow those instructions to the T. So as a hospitalist, when I was discharging a patient with major wound like this, I would like hunt down the surgeon or the wound care nurse and get the specific instructions, which is usually always in their notes, but sometimes it was hard for me to like pull and identify. But yeah, wound care is a whole separate topic or a whole separate specialty. Shout out to all the wound care nurses and wound care surgeons and wound care everybody.
Stepped out.
Did you tell anybody?
Right.
I was treating a young woman I met on the street team.
Did she
Street team. It was an interesting choice.
Here, I need you to be here. And while you stepped out, Roxy died.
Oh man, I'm sorry. I didn't think she would be gone that quickly.
That's heavy, you know. It's like as if she could do something different she couldn't have. But he's just letting her know, like, don't put it on PTMC's dime.
Just tell them the truth and hope they stay for the treatment that they need.
Martha took off. I'm gonna call her when I get a chance.
Good advice.
Yeah, but can't we just tell the agents to fuck off?
They are not going to leave without their patient. We just need to treat her.
Even if she's undocumented? All patients, regardless of immigration status, have the right to emergency care under MTALA.
MTALA, EMTALA, that is a very cool law. That basically says once you hit the emergency room, no matter what your insurance status is, no matter what your immigration status is, your citizenship status, like you get treated. And as a hospitalist, I commonly had to talk to the ER doctors to make sure that they called the appropriate specialists before the patient got admitted. Once you type the word admit to, you hit orders on the system, thing that says orders, you type the word admit to, and you click the proper order. And then once you hit inpatient, like now that's when the clock starts. A specialist can decline seeing a patient for that injury once they're admitted to the hospital. But if the ER physician calls them before the patient's admitted, they're covered on the EMTALA law. So that's the context that I've heard the EMTALA law practiced. And I've had to kind of use that word sometimes when the ER doctors are like, hey, well, you know, this isn't like an issue that I need to deal with right now. They can be triaged and you can call the cardiologist when the patient's upstairs or like when the patient's admitted. But if I know it's a tough case like this, where it's an undocumented immigrant, I need all the consultants to be called before the patient gets admitted. And that's like a huge buffer a hospitalist has to carry, which is like making sure the patient's and advocating for the patients in the right way.
History of renal colic, heme positive, urine BP crashing.
Okay, renal colic, urine positive. That means like kidney stone, UTI, sepsis, blood pressure low. Like it is an acute emergency and it is time sensitive.
Heme positive urine doesn't always mean kidney stone. 2 anticubital lines, biggest ones we've got. Eat fast.
That's true. His point is like low blood pressure is not always sepsis or UTI. It could be like internal bleeding. So 2 big IV lines.
Who worked up this patient?
To give a lot of fluid or
Ultrasound showed
blood.
dilated ureter and mild left hydronephrosis consistent with this history of renal colic.
What about the aorta?
I didn't look at the aorta.
What did you present to?
Dr. Mohan?
You said the rest of the ultrasound was normal.
I meant that the other kidney was wrong.
Okay, so the abdomen has like multiple structures, not just kidneys and ureters, which is what he focused on. And once it was abnormal, he stopped looking at the rest of the abdomen. That's crazy, right? Because, right, it's just crazy. So he has to look at so many other things. You saw the look on their faces. It is like tunnel vision. When you see something that's wrong, you're like, oh, that's probably it. But that's the confirmation bias. We talked about that a couple episodes ago.
8 centimeter AAA with massive free fluid. Ruptured aortic aneurysm.
Wow, ruptured aortic aneurysm.
Engaged in the left AC, 2 units whole blood on the infuser.
Assisting ventilations. Breast paragonal. Calcium gluconate to counteract hypocalcemia.
When you're doing a fast ultrasound, you need to do something systematically, like check specific areas, and that's what it's for. You need to like check all the boxes, and that's where checklists and check marks do work, and they are help. Like you can be an intuitive clinician, a good doctor, but you do need to follow protocols and the list in place, and that's why protocol-driven medicine exists.
Why don't you see if you can't squeeze a unit into that peripheral line?
Should somebody place a central line?
Long central line is slower than short, large bore peripheral.
Flows.
Wow, this show really got that correct. Basically, it's slower rate of infusion of fluids and antibiotics and blood transfusions if it's a long, thin central line versus a short, wide line. It's just the law of the radius of how wide the vein is or how wide the catheter is.
Dolly's down to 68. And it's
You can see how busy this department is, right? You've been nothing but a distraction and a disruption since you've been here. You know, patients come in here for help, right?
Why do they gotta look like
Sick
that
or
too?
they're injured,
They have to be.
documented or undocumented. They have a right to emergency care. But please, for the love of God, can you just go wait over there in the room with your detainees so I don't lose any more patients or staff?
No problem, Doc.
This is actually happening. This is not fiction, WellBeings. This is actually happening in ER rooms all over, in emergency departments all over the world. Patients are leaving against medical advice when immigration enforcement is present. And from a public health standpoint, it is a catastrophe. Tell them the truth and hope that they stay. That's the only tool he has in that moment, because hospitals are supposed to be sensitive locations where enforcement personnel are not allowed to be. But it's really complicated.
This is Azurmendi. Where are you going?
Oh my God, oh my God, oh my God.
Let's get you back inside to your son. That's okay, that's okay.
I guess Al-Hashimi had like the right mind to go and like follow her out, because that's like, oh, I got chills all over my body. She feels like such a terrible mother. She wanted to just walk in front of a bus, and that's like a lot.
Come on, she's cleared to go. We're leaving.
Hey, man, you're hurting her.
Hey, get your hand on.
hurt her and Jesse stepped in.
I know. I'm
She's documenting for her social media, and that's why social media actually matters, because you can document in real time what's actually happening. You don't have a skin in the game. So I'm so glad she's documenting it. That's wild.
Don't say anything. You don't have to say anything. They can't make you say anything. We'll get you an attorney. I promise. We'll get you out.
He's a real nurse in real life. I love it. What's that, Jeff?
I want to say I'm sorry for being an asshole on your first day. That was completely inappropriate, and if I could take back what happened, I would, but I can't.
Okay. Hey, I'm sorry. I don't buy it. Everyone thinks you're just an addict who went to rehab, and you've convinced everyone here that you've changed and you're owning up to your mistakes, and they welcome you back with open arms because you're still the golden boy, and I think it's bullshit.
And I can promise you,
I love that
I'll
she's
take my fair share of punishment for what I
called.
You fucking stole drugs from the hospital. I should have reported you to the state medical board. You should have lost your license and gone to prison.
You don't know what I've been through.
Okay, this is so sensitive. I love Santos here. She's just pointing something out that, like, look, this was a really complicated issue. It's your first day back. Like, kind of judging him, but kind of giving him tough love too.
My wife threatened to divorce me, okay? I almost lost my kid.
Yeah, that's what happens when you fuck up. Oh, tell everyone here you stole drugs and got kicked out of the ED because of it. Until then, stay out of my way.
I don't know if that's like really necessary or not. She's not his ethical police mother, sister, wife, or anything. She's his coworker, and maybe she cares about him enough to get that in there with him. But that sounded like, honestly, I mean, my personality is a bit like tough loving like that too. Like, come on, if you want to get good with me, you got to get good with everyone. She gets it right without being super obnoxious. She's just trying to put him in his ethical, moral place. And maybe that's what he needs, because maybe he didn't really learn. Episode 11 is one of those episodes that feels like I went to work myself and I actually did all that stuff myself. He just did such a great job depicting the ICE agents, the heat stroke young man, the little boy, he's not a young man, and the xylazine wounds, a missed abdominal aortic aneurysm. If there's anything that I want you to walk away from this episode with, is some things are silent but need to be addressed. The Pitt is doing something really important here, which is mixing up politics, real ethics, real medicine, and bringing it to your living room. It's bringing awareness around hot topics, and my job is to make sure you understand what you're watching. So if this helped you, smash that subscribe button. Let me know what you think. Drop a comment, and I'll see you in the next one. Own your health, own your future.